I started looking at the data, and I did notice that unlike other counties in North Carolina, Durham had more overdoses among Black residents than any other ethnicity. That's why my organization took it upon ourselves to identify what the challenges were. So, Together for Resilient Youth is a coalition of coalitions. We have 12 stakeholder representative groups that look at substance use in a collective impact way. In this case, when we're talking about opioids, we're looking at 7 strategies for community change, the framework that was presented by the CDC in order to prevent overdoses. If we prevented the root causes of individuals needing to use drugs, we would not have this challenge. This is where we focus on adverse experiences, adverse climate experiences, adverse childhood experiences, adverse community experiences, atrocious cultural experiences. This is where our focus is, and how to be resilient after experiencing some of these things. The first thing has to do with preventing overdoses generally, and then talking about naloxone. One of the issues in Durham, according to the data, has to do with individuals consuming prescription drugs with alcohol. And then fentanyl is a challenge for everyone, so make sure that fentanyl is not used by anyone. But then when it comes to naloxone, it's normalizing the use of naloxone and normalizing the impact of naloxone, that it only takes one spray to save a life. If someone is unconscious due to something other than opioid, then it won't hurt them. And because we have Good Samaritan law in North Carolina, then you can't get in trouble if you try to aid someone and it doesn't result in the outcome that you want. It's not just education in print. It's education in community. We train anyone in the community is able to go through the Health Ambassador course free of charge. In terms of the opioid epidemic, imagery is extremely important if we want to ensure that a subject is important to any and all individuals, then their faces and images should be present. The more ways there are in order to get the message out, the better. We are all in this together.